Welcome to Season 4 of the Lighting Your Way podcast. This season, we will hear from all types of guests who share their experiences, their insights, and their stories. For this episode, I speak with longtime Guardian Nurses colleague, Megan Swider, who also, as in last week's episode with Charlotte Jeroma, is one of the finalists in the community nursing category at the Nightingale Awards of Pennsylvania. Good afternoon, Megan Swider. It is good to have you here.
Thanks, Bed. Glad to be here on this beautiful sunny day.
Yeah,
Thanks for
great.
having me.
I'm happy to have you. You are one of our two finalists for the community nursing category at the Nightingale Awards of Pennsylvania. So congratulations to you.
Thank you very much. I'm actually honored to be a finalist and amongst so many great health workers that were nominated, especially against, I'm one of the two for the community health. And I feel very grateful that I have the opportunity.
Yeah, there is. We have two finalists. We had last week we talked to Charlotte Jeroma, who was a winner in the patient choice category, and then both you and Chris McCarrick were nominated, and of course are finalists in that. So we'll talk to Chris next week. So I just wanted to talk a little bit about your nomination, and then I'll talk about your work at Guardian Nurses. So you were nominated by a colleague. Did you know that you were nominated?
No, I actually was not. I was very, very surprised. I work with a great team with a lot of nurses who are very experienced. So, like I said, I was very, very honored when I found out that I was a nominee.
Yeah, it was, I guess when they announced it was in July sometime, wasn't it, or somewhere?
Yeah, it was, I think the end of July is when I found out, right before I went on vacation.
Yeah, great. Oh, perfect. You could brag to all your brothers and family members.
And I did. Yes,
good for you. So the community nursing category at Nightingale is, like parish nurses, home care nurses, case managers in the community. So folks that work outside of acute care and outside of academia. So let's talk a little bit about your role at Guardian Nurses. You are a mobile care coordinator for a union in Philadelphia that covers the, a lot of white collar jobs, librarians, I think parking authority, right? Isn't that true?
Correct. Yes. I work for DC 47. I've been working with that union for 4 years. They are workers, like you said, white collar workers. It's Philadelphia Parking Authority, librarians, DHS, social workers. So, a variety of workers for the city.
Right. And Department of Rec too, I think, right?
Yes. Yep. There's a lot of work. Yes. Airport. Parking Authority.
Okay. And how many total, as we say in the biz, how many total belly buttons do you have in that fund?
We have right around 10,000. So
wow.
That includes the members, I believe, which is probably around 4,800. And then we refer to the belly buttons as their dependents. So that's the members plus their dependents.
Okay. And you are a team of 3 nurses. So you're one. And then we have 2 other nurses. Of course, one is Charlotte, who was the patient choice winner. So what is your role on that trio?
So my role is I am the mobile care coordinator for the chronic complex, which means that I take care of the patients that have multiple chronic issues. It could include diabetes. I mostly work with the diabetics. Charlotte and I share the chronic patients, but I mostly deal with the members with diabetes, but they can also have multiple other conditions that go along with that. And then Eileen cares for all the acute members, the ones that show up in the hospital.
Okay. And in caring for them, right? I know that we've talked on previous podcasts about the work that our mobile care nurses do, but you're out and about, right, every day. Tell us about your job.
Oh yeah. So most of the time I will, I'll get referrals either through Eileen in the acute world. So if they have a diagnosis of diabetes, she refers them to me. I also get information, people for their labs from the lab reports. So then I'll reach out to the members and I'll engage them and talk about their diabetes. But like I said, they also have other chronic issues that they're dealing with. So a visit for me could be either with their primary care or with many different specialties.
Okay.
It could be a cardiologist, nephrologist, endocrinologist. So the members that I work with have multiple specialists along with their primary care.
Yeah, I mean, when you have a chronic disease in this healthcare system, it's a lot of care coordination. That's pretty much what I'm sure your greatest role is.
It sure is. I try to, work with the members and try to keep them organized with their care, making sure that they're following up with their primary care, and then along with the primary, their specialist. So I do a lot of accompaniments to doctor's appointments, and also if needed, I will do home visits if they need.
Great.
Yeah, if they need more education and to go over care plans with them, go over discharge instructions with them. So yeah, it's a lot of coordination of care.
Right. And I guess, for the average bear, for the average layperson, it can be overwhelming. I think even when we talk about patients, even nurses, even doctors, when you're sick and you're in the healthcare system, you don't really want to have to, coordinate your care. You'd like to know that it's being done. But I think that's why you've been so successful in your role, is because you are really doing a lot of maybe even literally hand holding, but you're wrapping your arms around the patients that you have and shepherding them through the healthcare system when they have some complex issues, right? Medical issues.
That's true. Remember, as they also have these issues, they're also trying to work full time. So, they're trying to, along with keeping their work going, they're also trying to keep up with their health. So like I said, I'm there just trying to help them through the healthcare maze. If I need to help them schedule appointments or get a referral for their specialty, depending on their insurance requirements.
Okay.
And just being there as, another set of eyes and ears during their appointments with their doctors.
So
trying to help them answer questions.
As you're there with the doctor's office, and we've heard, and certainly people have experienced, those that are listening, that our healthcare system has become more complex. What are you seeing, as you sit there waiting with your patient to, for an appointment? Like, are you? Tell us about your experience with. I know we've heard about short staffing and there's not enough people to answer the phones, but what's been your experience in the last, say, 6 months?
During the last 6 months, I think it's gotten a lot harder, especially after COVID, trying to fit people into appointments. So the biggest challenge is trying to get them an appointment. So like I said, for the patient or member trying to schedule their own appointment, they could be on the phone for 10, 15 minutes just trying to schedule an appointment. And then once you get to the appointment, I think more the follow-up is what's been challenging, especially if they're hospitalized. That's where it's really been a challenge. The members with their follow-up home care, there's been, a shortage with nurses. So that's been really hard. trying to coordinate that.
Tell me, so let's go back to, let's go into the hospital a little bit. So I know, again, same thing, staffing shortages, a lot of people, nurses are taking on more patients. I know that you have been in hospital and kind of observing that. We've talked to other nurses on our team about what their experience has been. What's your experience been?
In the hospital, like I said, a lot of patients complain about just not knowing what's going on. Like I haven't talked to a doctor, I haven't talked to the nurse, I don't know what's really going on. So we're there just to be that liaison between the patient and their medical team, just to bring them up to date, whether if we have to bring the nurse in or the doctor in just to explain to the patient. And also to help them, like during discharge, I've been seeing a lot, the long waits, when they're given a discharge date, waiting for the doctor to come around. So I'll go in, I'll try to get in before the patient is discharged and bring the nurse in, talk about what the follow-up care is going to be. And then after that, I'll help them schedule their follow-up appointments with their physicians, whether it's a specialist, whether they have to follow up with their primary care.
Yeah, I think that has been, at least throughout even before COVID, I think discharge from hospitals can be very challenging and often, what's the word? I guess, just brief. So, because they're discharging folks and nurses are trying to take care of other patients. And, you get now printed out 20 pages of discharge instructions, and a resident might come, or a doctor or a nurse might come and say, okay, here's your discharge instructions. And you're like, okay, sign here. And you're like, what did I do? So I know that we've had, I know you have had some experiences, but I know other folks on the team have had where, the patient's maybe had a stroke, and, you get home and you look at his instructions and there's no follow-up to a cardiologist or to a neurologist, right? And you're thinking, wait a minute.
Yeah, I definitely have had experiences with that. So like I said, that would be a case where I would, try to meet them, schedule a home visit, go over, review all the discharge instructions with them, and sit there and make phone calls with them, trying to schedule all, because it could be, multiple specialties with the neurologist, with the PCP, with the cardiologist. So it takes time. And I think the patients just get overwhelmed. First of all, they're just getting home and, just getting back to normal. And it's just a lot, I think, for these members or patients to have to deal with on their own. So I think having an advocate, is a really good thing for them.
So Meg, is there a case that comes to mind right off the top of your head that you'd like to share with us in terms of depicting what your work is?
Sure. Actually, there is a case that comes to mind. I've been working with this particular patient for about a year and a half.
Wow.
I've really gotten to know this patient. When I first met him, I was trying to coordinate get all of his information, try to, just piece everything together. And I found out that this member lives by himself. This patient lives by himself. He has minimal support from family and friends. So I found out that he's wheelchair dependent and on oxygen.
Wow.
So, yeah. So a simple task, just as going downstairs to pick up the mail, he could not do because of the function of his wheelchair. It was just too big to get through the doorways, to get onto the elevator, just to go downstairs. Wow. So I talked with him and I said, you know what? Let's try to figure something out. You need to be more independent. So I reached out to the patient's primary care, the one that he had for years, and I just kept hitting brick walls. I was not getting any information. I requested medical information, and they would not provide it, or they said they didn't have it, which I found odd.
This was
So then I
the primary care doctor?
yeah,
Oh,
yes, this is the
okay.
primary care doctor. I even went to visit. I went to the primary care office with cookies in hand to see if I can sway
Atta
some
girl.
information. And I was told that the doctor was busy. She was with a patient. And upon entering the office, actually, it looked like it was, advertising for Botox. So at this point, I thought, I don't know what's going on with this. So I convinced the patient to switch primary care physicians, and I was able to switch him to a Blue Cross BCD.
Blue Center of Distinction? Blue,
yes.
Blues. Okay.
Yeah, the Center of Distinction. So I went to the appointment with him. He loved the office, loved the staff. They were very accommodating. So again, the goal was to get this patient independent.
Mm-hmm.
So I worked with the primary care, and I found out through my research that Moss has a wheelchair clinic, which I did not know before.
Okay.
So what I was able to do was set him up for an appointment. We went together. They did a full assessment on the patient,
Mm-hmm.
and it took a while. I have to say, it didn't happen overnight. It took
Mm-hmm.
a few months. But 2 weeks ago, on a day like today in Philadelphia, it's sunny, beautiful. He sent me a picture that he received his electric scooter. He was outside. He's like, I've been outside for over an hour, just driving around, taking in the sun, and I was able to pick up my mail. So
That's
just
great.
hearing that, just hearing that, he was so excited, so thankful. He couldn't believe that somebody actually stuck with him through this whole process and was able to complete, the goal that he had set.
He better be careful. He's going to use all of his juice in one afternoon.
I know. But I'm just so happy because, like I said, this is going to allow him to be more independent. And now he's asking me for paperwork to sign up for CCT so he can go to appointments by himself. He'll be able to schedule appointments, and he won't have to rely on the one person that is his transportation that's able to get him to appointments, but it's always on his time. Not the patient's time. So
okay,
very happy.
So that's a perfect example. I mean, working with him for over a year and a half, you said, and then finally getting him to be independent. Right. That's a credit to you just to get him to that point and to be independent. Because while you want to help as many you can, you have to help other people with more perhaps pressing issues.
Yeah.
So that's always a interesting juggle. I know that you nurses deal with when you're dealing with complex patients. So Meg, the other question I wanted to ask you is that you have a soon to be a nurse in your family. Your daughter, Kirsten, is in Temple's nursing program, I think, Temple University.
Yes, she is. I am super proud of her. She's following in Mom's footsteps.
That's great.
And I know a lot of people. I actually had people say to me, how can you allow her to go into nursing? I will shout from the rooftops. I love what I do. Nursing, there's so many things that you can do with nursing. So I am really excited for her, and she is really doing well. She's putting a lot of effort into it and liking every minute of it so far.
Love it. And that's a 4-year program at Temple?
Yes, it's a 4. Yes, she'll go for her bachelor's.
So she'll, do they still, I think, when do they, so they have 2 years of classroom, and then on junior and senior year is when they do clinical?
Yes, but actually with Kirsten, freshman year last year, they allowed the students once a week to dress in their scrubs, first day in scrubs, I got a picture of her taking a picture of herself, a selfie in her scrubs. And, they taught her, they teach them the basics, hand washing, just the basics of nursing. But I think putting them in that position, it just gets them excited to just wear the scrubs and being in the hospital setting. So, and then next week, she'll be starting clinicals. So this is her second year. She'll be starting clinicals at a facility.
Oh, lovely.
Really
that's great.
Start that. Yeah. She said she's really excited just to get out and start doing that. So I'm really happy with the program so far.
I think, it's so encouraging and heartening for me to hear that, right? Because there's been a lot of going on in COVID with the image of nursing and with the after COVID with the shortages, and it's nice to know that there's still young people who are interested in becoming nursing, and certainly kudos to you for shepherding her.
Yeah.
And I'm sure she's very proud of you being a Nightingale finalist.
I sure hope so. I think, they do. I think they really are. They're proud of me. They said they are. But I also have a niece. I also have two nieces. One niece already, she's a nurse at CHOP, and I have another niece at the University of Pittsburgh that's in the nursing program. And then another niece that's in pre-med at the University of Pittsburgh. So I hope we're starting a trend here in my family.
That's great.
Field.
Oh, that's great.
Yeah.
Well, as you know, it's a great career. So I'm glad that Kirsten. I look forward to her graduation.
Oh, thank you. Thank you.
So, all right. So you have your finger on the pulse. You have a daughter who's second year. I'm going to ask you the $64,000 question. Given all that you've been through in the last couple of years, and certainly have seen with both your patients and I'm sure your family members, how would you, as a Nightingale finalist, if you had a magic wand that you could just boop, how would you fix healthcare?
How I would fix healthcare, I would start with empowering patients to be their own advocate. I think taking hold of your own healthcare and knowing what's going on and asking those questions. Never think a question isn't worth asking. I think just taking hold of your own healthcare and being responsible. I think that would, be a good start. I honestly wish, the job that we do as advocates, I wish everybody had an advocate, honestly. If we could make that happen, that all patients have advocates, I would really like to start there. So
okay. Well, from your lips to God's ears. Right.
I know. Yeah. But, we come across so many people.
Well, how do you I know it certainly sounds like you wanted to strive to get that one patient independent, but in your work with patients, how do you empower them?
The way I empower patients, I sit down and talk to them. I don't judge them. I look at them like I would just myself, trying to organize their care. It's really hard. People are out there trying to make a living and trying to keep their health care, together all at once. So just sitting there and being a resource and, providing them with information and education. But like I said, don't judge. I don't judge anybody, in positions. So that's how I do. I just talk to them like a friend.
Yeah, empowering patients is so valuable because I think they do feel like they don't have power, and they do, but they don't realize that. And I think even just having someone like you by their side to kind of model behavior that you can ask a question. It's like, oh, they didn't bite Meg's head off. Maybe I could ask a question too. So that's good. That's good. Exactly. Good. Good suggestion. Thank you. We're going to try to fix healthcare by the end of season 4. Here we are.
Oh, I hope so. And also just a tip of advice, organization. I like to tell my patients to possibly keep a folder of all of their medical information in one place.
Okay.
I know I've talked to many patients that, I can't find my script or I can't find this paperwork. So, if there's one tip I can give the listeners out there, just try to be organized with all of your information. It'll make your life a little bit easier.
Do you find that, that's certainly a great tip, because with all the patients that you're working with, probably with multiple physicians and multiple meds and all the things they have to keep track of, do you find patients, I'm just curious, do you find patients kind of leaning toward using their phone for that? Like, because there's a lot of paperwork in healthcare, right? Prescriptions come in.
Right. I know we do. We get a lot of, a lot of offices now send things, through email. But in my experiences, I do not feel like people use their phone a lot. I feel like they're surrounded and drowned with paperwork around them.
Okay.
Unfortunately, not everybody that I deal with, a good amount do use their cell phones, but I don't think they use it for medical reasons.
Yeah. Just to your point, if you took a picture of your prescriptions, or if you took a picture of your meds, or I think in one instance you said to take a picture of your discharge summary.
Yes. Yeah, that I try to do that at the end of appointments with the patients.
Okay.
I just try to take a picture so I have all their information so I can help them, set up their appointments or, organize their healthcare. Because like I said, I've been on my way to appointments and have gotten phone calls. I can't find my script, or I don't have the referral. So, I've taken pictures of that information for my patients just so in case that happens. And it has happened. It's happened
I'm sure.
quite a few times. So
I'm sure.
I try to get them to, get a folder and keep all of their information. And I always tell them to get a copy of the disc if they ever have any radiology test. So, that helps if you ever have to go for a second opinion. That's another tip.
That's good. Good. Thank you.
Yeah.
I heard you say about getting the referral, the dreaded referral, right? Oh, I don't have my referral. Jeez. Okay. So, the most important question, Meg, is do you have your outfit ready for the gala?
I've been looking. Yeah, I'm really looking forward to it. I think I've been talking to a lot of my colleagues. It seems like we're going to have, a lot of people there. So I'm really looking forward to a really nice night.
Great.
Honoring all of the finalists.
Yeah, there'll be a good crowd. I think there's, last I heard, there's over 300 people coming. So it'll be, and it is a wonderful night to celebrate, as I say, all that is good in nursing, because it's just a great night. There's a lot of wonderful nurses being honored like yourself. So congratulations again. And thank you for taking time to talk with me.
Yeah, thank you, Betty. I really appreciate you giving me this time.
Okay. All right. Take care.
Wonderful night. Okay. Thank you. Bye-bye.
All right. Bye-bye. If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. That email again is podcast@guardiannurses.com. We would love to hear from you. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.